This video is brought to you by the Waltham Forest Falls Prevention Service. With an ageing population and increasing strain on the NHS year on year, we need to utilise our workforce now more than ever. Community pharmacies are accessible and located across the whole country. There are over 14,000 pharmacies in Great Britain, each with at least one highly qualified pharmacist that has done at least 5 years of training, making community pharmacies very well placed to deliver services that alleviate some of the pressure on the wider NHS. Falls are already a big strain on NHS resources, and this is only going to get worse. By 2037, the fraction of people over 65 is predicted to rise to 1 in 4, the age group most widely affected by falls. In 2013 to 14, there were over 250,000 emergency hospital admissions related to falls, and falls are estimated to cost the NHS more than £2.3 billion per year. There's also a huge impact on the patients. After a fall, there is increased risk of 1-year mortality and a great number of patients that have to go into long-term care. For example, for hip fractures, 20% of cases are fatal and 50% are permanently disabled, leaving just 30% of people that recover. When a patient is admitted to hospital with a fall, they are often treated for their injuries and then return home, without much exploration into why the fall occurred. There are many potential causes for falls, and patients may have several contributing factors. Therefore, the approach needs to be multifactorial in nature, as is recommended by NICE. As a result of the huge cost to both the NHS and a patient's quality of life, there is an urgent and increasing need to explore preventative services that save money in the long run. In addition, the Waltham Forest Borough has higher rates of falls than the London average. The Waltham Forest Health and Wellbeing Board has acknowledged this and have actually called for an early intervention and prevention falls programme in the community. So what are we proposing as a solution? This service is a community pharmacy-based falls prevention programme, which aims to reduce the number of falls and hence the burden on the NHS. Patients of high risk will be asked if they wish to take part in the service. This includes those over 65 that have either had a hospitalising fall within the last year, have a fall risk increasing condition, or are on fall risk increasing medications. Intervention will take the form of a multifactorial consultation wherein several factors are addressed. These include a medication review, education and information giving about ways to reduce falls, lifestyle discussions and advice such as alcohol consumption, strength and balance information, fall risks in the home, and vision. Outcomes of the intervention may simply be providing the patient with information on things that they can do to reduce falls, referral to other services such as the opticians, or recommendations for the GP to change or withdraw medication. So does it work, and is it cost effective? Studies have suggested that multifactorial interventions, including the provision of information and the withdrawal or dose reduction of fall risk increasing drugs, is effective at reducing falls and is also cost effective. For example, a study conducted in the Netherlands showed that at a 2-month follow-up after the intervention, 3.4 falls had been prevented per patient and saved an estimated €491 per prevented fall. In summary, the burden of falls to the NHS is huge and increasing every year, leaving an urgent and unmet need for preventative services to tackle this. This problem is especially prevalent in Waltham Forest, and there has been a call for preventative services. With almost 90% of England's population living within a 20-minute walk of a pharmacy, and many patients already visiting community pharmacies, it is the logical place to carry out the service. Thank you for watching our video. For further information, please see the proposal documents.